Mega Man, Jimmy Easy. Come on.
Welcome to Advocacy Help Desk, a network of advocacy leaders sharing best practices and new ideas via this free podcast to help everyone in government affairs get better at their advocacy craft and having a lot of fun while doing it. Now to today's great show.
All right. Welcome back, everyone, to another episode of the Advocacy Help Desk. As you know, for being a listener of ours, or if you're new to the show, we are a group of advocacy professionals, practitioners, consultants, and all sorts of people in between that just want to help people with their issues, right? We know that advocacy folks are out there. We know they have questions. We know that folks have answers to the questions and have probably done those things before. And so we started this show about a year ago now and have done dozens of shows with dozens of different folks, just talking about sort of what's going on out there. What are they trying? GOTV, PAC, advocacy, grassroots, grass tops, musical interest, which we'll get into today, and everything in between. So thanks again for joining us this week. I am Brian Fracken, CEO of Spark Influence and Advocacy Platform, and I am joined today as co-hosts with Nick DeSarno from the Public Affairs Council. Nick, it is always a pleasure to see you. How are you doing today?
Good. Thank you so much for inviting me on to co-host again. I know Andy Polk is busy at footwear, so he is taking the day off, but I'm excited to be here. A little bit about myself. I work at the Public Affairs Council on my day job. Which sometimes for me is a night job because I live in the United Kingdom, but I work US hours. So it is like 7 p.m. right now for me. And I'll probably be working a little bit later. But a little bit about the Public Affairs Council. We're essentially the trade association for folks that are involved in grassroots advocacy, lobbying, political action committees, public affairs / policy communications. We have an office in Washington, D.C., and we have an office in Brussels. We do about 120 workshops, conferences, webinars, professional development events a year.
I'm going to interrupt you. They are fantastic. In fact, I just had one of my employees go to one just last week. She brought it up to the whole group today. We did a whole group call with notes from the PAC one and solicitations and everything else from last week. And it was amazing. The entire group, we all loved it. We all took notes. It's just, if you can go to a PAC event, you absolutely should. And that's it. Next. Please, Nick, continue.
So with that, I appreciate that. Yeah, so that's what we do. We also answer member questions. If you want to reach out to us, we're similar to the Advocacy Help Desk in the sense that if you have a question about the advocacy space, we are happy to answer it. I get questions like, who's a great contract lobbyist in Saudi Arabia? Or questions like, we're launching a public policy Twitter handle for our organization. What are some best practices? Who do you look to for advice? And so if you have any of those questions, please feel free to reach out to us about them. But I'm really excited because we also get to work with great folks, one of which was a speaker at our Digital Media and Advocacy Summit just in August. And she killed it. And it was one of the reasons why I wanted to invite her on today. We have Kristen St. John, who is the Deputy Director of National Grassroots Advocacy for the National Association of Community Health Centers, NACHC. And she's been there for a little over a year, but she's been in the advocacy space for a while, normally kind of in the healthcare nonprofit space. She did some advocacy work for the National or the Children's Hospital Association, and which was, you were there for a while, I remember that. And then the Pancreatic Cancer Action Network. So you've been kind of all over the healthcare advocacy space. And with that, I just wanted to kind of, give us a little bit of information about what your work is currently and who you work for folks that don't understand or know.
Sure. Thank you. And thank you for having me. I'm hoping maybe eventually I'll be cool enough to make it into the studio.
So are we. We're going to get there too one day.
Yes. Basically, with NAC, I work with the grassroots advocacy team, the National Grassroots Advocacy Team. It's myself, Marie McCauley, Shamal Shepard, and Susan Burton. And we work with all the different primary care associations that are in the States, as well as community health centers in general. It could be, basically helping them build up advocacy for each of their health centers, deal with what's going on in the federal and the state government, helping them kind of, navigate that. Not state as much as they're experts on the state side, they know their people, but just giving them the tools. And but on the Fed side, we kind of, we're giving the tools and we're saying, hey, we'll try this, try that, to kind of get the word out there. Because community health centers are, I always say, like, the best kept secret in the United States that a lot of folks don't realize how many they are and what they do in their communities sometimes. Because
it is fascinating, Kristen. You're spot on with that. I was on Reddit, I don't know, a month or two ago, and in some weird subreddit somewhere, in some weird, like, I have this problem, I can't afford healthcare, I broke my arm, I did something. And the conversation turned to, have you ever heard about NAC? Do you know about PCAs? Do you know about CHCs? Did you know you can go there and get treatments free of charge at times for certain conditions? Yeah. And everybody there was like, oh my God, I had no idea. This is amazing. This is fantastic.
Yeah, because it's interesting because, I'll be honest with you. I've been in the healthcare advocacy space. Gosh, my first job was with the Arthritis Foundation many moons ago. And, since then, when I applied for this job, I'll be honest, I did not know that much about community health centers. And the more that I found out before, while I was actually interviewing for it, and then the stuff I've found out since has been amazing. Different ways that they're dealing with, some of the health centers, especially down south in California, dealing with, natural, like, hurricanes and all the fires, how quickly they kind of like, okay, how can we do this and work with people in our community? They're kind of like the go-to with the local health departments with certain things, but people don't know that because a lot of them, there's not like a uniformed umbrella. They, some of them have different names. And like I said, it's in this little bubble that we're in. And let me preface this with, this is all my personal opinions. Like, I don't want anyone coming at me, but it's interesting, but it's helping for me. So my main concern, or two of the main concerns I have with my job right now, is helping the organization as a whole, and also the health centers kind of break through that insular bubble, and kind of and talk to folks outside and actually bolster up partnerships, and then also to help people at community health centers, may they be patients, the doctors, the nurses, just the staff, all the levels of the staff, kind of know that they have a voice. A lot of community health centers work with and focus on the community that a lot of folks don't know is there or don't want to know that's there.
Sure.
So, just to kind of say you have a voice and you can use it, and people do care about what's happening to you. So, trying to, bolster them up and give them the tools that they can use to reach their elected officials, maybe local, state, or federal.
Right. Let's dive into that then. So you're trying to keep you're not alone, of course, right? And Nick will talk to us a little bit about that as well, in terms of, that is what almost every organization that's probably a member of PAC is trying to do, which is to better give their folks the tools to make their voices heard and to understand that their voice does matter, right? And that they can make a difference. And so I think
not everyone has such a great mission though, sometimes it's like a big company, but a lot of times it is folks like, that are doing the Lord's work and taking care of people.
That's right.
Who are disadvantaged.
No, you're absolutely right, Nick. And so I think that one of the things that we were talking about before we even started this was, one, your disclaimer. So I'm glad you made it. But two, let's talk for a second about the podcast that you guys do, because I know that that's a new way that you're approaching your people to give them an idea of both what's happening in Washington and what the latest is and what tools they have and what you're doing on their behalf and all those things in between. So can you tell us a little bit more? By all means, say your little spiel here about the podcast and get people to subscribe, of course. But tell us a little bit more about why you started and sort of what does a weekly show look like and how do you organize it?
Sure. We actually, this all goes to accessibility. We have a Washington update like everyone else in DC does. We're kind of letting folks know, and this is, obviously this is going to CEOs, PCAs, primary care associations, but also anyone in the community health center community. If I can't bubble something, whatever. And so if you go to hcadvocacy.org, you can actually sign up to become an advocate. And what you'll do is, what will happen is Tuesday nights, there is a newsletter that comes out, and it's everything like updates of what's going on in the administration, updates what's going on in research, updates that's going on in state, and what we're reading, and like little bits and pieces of information like that. It's a lot, and I know, like probably anybody, you have a tendency to get in the weeds sometimes, especially when we're talking about the administration and regulations and what's going on with 340B and all this other stuff. So what we were trying to do, because everyone, especially at the beginning of the COVID-19, everybody was home, and the amount of emails that were going was just bananas. The emails and the Zoom calls and stuff like that. So what we tried to do, and it was an idea from my one colleague, Marisol. She's the idea person, bless her heart, because I'm going to give her props in a second about the playlist. She was like, how about we just do, have you thought about doing a quick 10,000 foot view? This is what's in the Washington update, with a little bit of explanation of each things, highlighting certain things, and then also encourage people to go to, for more information, to go to their Washington update. So it's called Advocacy in Minutes. We use SoundCloud, and I actually put it on social media on Facebook and Twitter, and then I kind of do a little bit of self, like, hey, advertising, and put it on my LinkedIn, my personal LinkedIn. But I always tell people the first couple weeks we had a couple folks who were listening, and then now all of a sudden, if we don't get it out by Wednesday by about 3:00, we're starting to get emails from folks like, hey, is it ready yet? Are you guys doing it this week?
Oh, that's great.
Yeah, so it's really good. And the first couple of weeks I was like, don't suffer from FOMO. You can when you go on SoundCloud, you can actually subscribe to it. So any NAC podcast, it'll be told that, hey, this is new and stuff like that. So it's actually fun. We are goofy. It takes a lot longer to record than it should, but it's just us reading it and stuff like that and yelling at each other. So
I love it though. That's exactly what podcasts should be. And I think that's where a lot of associations go wrong. Nick, I'm interested to get your take on that as well. Have you heard from folks that are saying, hey, should we loosen up? Is that something that other people are doing? What kind of questions do you get around starting a podcast? What kind of questions do you get around the content and the pieces that people should be looking at?
Yeah, I think there's the good thing is there's a couple different approaches that organizations have taken. One is kind of like what Kristen said, right? Like we have a newsletter, we have all this content we're producing already. Where are these other avenues that we can deliver that content? Because like maybe I'm a really busy nurse and I'm walking to the community health center and I want to listen to this versus having to read it in the morning when I'm trying to deal with like childcare or whatever is going on in their, lives. And so that's something that I think is important, is like you're giving someone a different view of it. And so, because I think a lot of times we look at anything that we do and we're like, this is amazing. Everyone's going to read it. And everyone will then know this like amazing policy brief I put together or this awesome action alert, right? Like in the real world, it doesn't work like that.
Right.
Right.
I don't read every single email that gets sent to me. I probably don't even read half of them. I hit delete, right? And so you need to find people in where they are in the space they need. And then I also think there's other organizations that have figured out how to use podcasts to, like you said, show their real personality, kind of move them. Why I think people like podcasts is that they're like a fly in the in the room on the wall, like they're listening in on a private kind of conversation. When it's too scripted and it's like 40 minutes of this like hard hitting interview, you just have people drop off. And so if you're going to be scripted, it should be short to the point and should be something that's like tangible and useful. And if you're not going to be scripted, you can go longer, but you have to be fun. You have to be exciting. You have to be engaging. You can't just be, here's the 7 questions and, like Walter Cronkite and just like shoot things at them. Because that style of interviews, that style of kind of podcasts is it's boring. Because there's a lot of bad podcasts out there also. We're not one of them. There are a lot of bad podcasts.
No, but we're definitely seeing that. Chris and I, so the podcast, great point, Nick, great point to both of you. The podcast provides another avenue for folks to be able to listen to and be involved with your content because yes, you have a website, you have PDFs, you have emails, you have all those other things, and you'll get, that net is out there, but this casts a wider net to folks who maybe don't have the time to read those and now can listen in for the 5-minute quick hits on what's going on or just being silly and getting to 20 minutes, but it's still there. I know that, this is one of those things that you're using in your overall messaging, right? To get the message out. I know you challenged or you're not struggles, I shouldn't say, but you're challenged with advocate fatigue, right? Can you explain a little bit about sort of what NAC's overall issue is, right? Because funding is always an issue, right? And how you guys have to then work differently than other groups because of that unique challenge that you have.
Well, it's interesting. We have support across the board. The situation, especially with community health centers, is that when you see pieces about hospitals closing down in rural America, community health centers are there kind of picking up the pieces and trying to help out with their community. And especially we're seeing this now during the COVID thing is the fact that yes, community health centers do get funding to a point from the federal government. But unfortunately, because of the issue with COVID just shutting down, like being so bad in some areas that they were shutting down and only taking certain people coming in, that they were actually losing the money that they would be normally getting in for, for example, some community health centers. And it was community health centers are different depending on what community they're serving. So, some community health centers, have dental offices, and you going in, they're getting the money, the reimbursement from Medicare, Medicaid, or even your own health insurance if you do have health insurance. So if you're going in for your annual or your every 6 month or, anything like that didn't have to do with issues in regards to COVID, all that stopped. So, especially this year, you have a lot of community health centers that were suffering financially because people weren't coming in because they couldn't. And unfortunately, as the atmosphere going on Capitol Hill was going on is that, yes, you had, members of Congress and their staff understanding how important community health centers were, especially as more and more people are losing their jobs. They were looking towards them for the healthcare aspect, and understanding that. But it'd be like, okay, yes, we will include them in this particular package, but as long as we include them, I need you to include my pet project as well. So it's almost like a political hot potato where, it's good, but, we we're going to, you know, use this as a way to get X, Y, and Z passed. I know this is a very rudimentary explanation. I mean, I could go deep into the weeds, but I think that this is probably like the best one, especially since we have 15 minutes to go through this podcast to kind of get through it. But you know, that's
we can go for hours if you want. I mean, I'll make this an extended version. You tell me and we will fire it up. No, but I am fascinated by this because, you know, as you say, you do have, you know, everybody loves the idea of healthcare, right? And so, you know, nobody's going to come out and specifically say, I hate healthcare, right? That's not going to happen. But it seems like PCAs and CHCs and your groups are being sort of held hostage to the whims of folks that want to include you in other bills rather than just passing it. And so you guys have a unique challenge with advocate fatigue, it seems like, in terms of you never know when it's going to happen. You know that people are supporting it, but it could be October, it could be September, it could be November, or in the last 2 years, it's going to be, you know, Christmas Eve and something happens.
Yeah. And see, that's the thing, is that not only it was kind of a double whammy, because like when I came on last year, it was like, oh, hey, you know, our extension is coming up and it's going to happen in July, that this is going to be easy. And all of a sudden July came and it was like, okay, what I just said, ignore everything. We got to do this. And then it was kick the can. And then the world blew up in February, March. And then it was like, oh my gosh, what's going on here? So yeah, we're getting hit from all sides, as to, you know, it's like, this is like beyond the perfect storm. You know what I'm saying? And Mark Wahlberg is nowhere to be found on the boat at this point. So
always disappointing when that happens, you know? Anyway.
For me, I will take a wet shirted Mark Wahlberg.
There it is.
It's the Boston kid in me. I'm sorry.
I get that. I understand. Nick, I jump in here for a second because advocate fatigue is something that affects not on Mark Wahlberg. Although if you want to, he was a genius in Other Guys. It's a very underrated movie. Anyway, jump in here for a minute, Nick, because I know that you get a lot of questions on advocate fatigue and long running issues. And so what are sort of some of the top 3 things organizations can think about in terms of avoiding advocate fatigue or just keeping folks involved? And how do you sort of turn that dial from stop hitting me up to, yeah, I really appreciate hearing from you because you're giving me the information I want?
Yeah. That's a great question. Yeah. I mean, it's definitely like, it's not, you know, just you guys as an organization. Sometimes I worked in like an office when I worked on Capitol Hill that was in the ag space primarily. He was the chair of an agricultural committee. And like every 5 years they have an ag bill, right? And so like there's this big buildup and then it gets delayed. And you know, it's like it's constantly like, this is the most important time, right? And you can only say that so many times to folks. Right. But like, I think where it happens is like, you know, first you have to be of value to your members and to your supporters. You have to show that you're just beyond just asking them to do something so that they stay engaged throughout the year. So you have to provide them something that is truly of value to themselves, whether that's, you know, helping them become a better advocate through training and stuff. I know you guys do a lot of webinars at NCHT. You know, I know you are constantly kind of not just you know, engaging them when there's an action that needs, but when, you know, how do you actually educate them about those policy issues?
Yeah.
The other thing is like, you should reward them or you should, you know, thank them for what they're doing. And so, and part of that is by keeping them updated, right? How annoying is it to like take action and then never hear from them again? You're like, well, did that bill pass?
That's our big, I mean, that was, there was a little bit of pushback by the fact that we send out stuff every week. And I said, when I came back from Vegas, you know, I was, one of the things that I learned in Vegas that I was able to
the Public Affairs Council meeting in Vegas, that is not just a random trip to Vegas, although that does happen too. That's fine. But yes, when you came back from the Public Affairs Council Advocacy Conference in Vegas in February, yes, continue, please.
All right, I'm in the room with the 3 of you, so
I know what you were doing in Vegas. I know what you're doing.
But did you? When I was at the PAC Advocacy conference in Vegas, it was great because one of the breakout sessions that I took mad notes about, and it was one of those situations where I was like, I knew it, I've been doing this, but I now can quote it, was the situation of sending that email. And even if the advocates are doing something as clicking here to go to another website to register to vote, or to learn more information about the census, or doing stuff like that, at least they're used to seeing an email from us at least once a week, as opposed to us just disappearing for a month and then come in and be like, oh my God, my hair is burning and I need everyone to to send something to Congress, even though I think that would be a fun graphic to do.
My suggestion is to folks is like, I don't know if your advocacy program is open to everyone. I think I'm a member of it. I sign up for a bunch of emails. The Association of American Medical Colleges, they have a grassroots network that's open to everyone, right? Because they have like, doctors, residents, they have all sorts of people, students, who participate in that. And they send great emails where they're like, hey, you haven't done anything with us for a while, take this quiz, or did you know, or share this info. They give you different things. And I think that, keeping it fresh. One of the last thing I would suggest that you guys, Kristen, you're particularly creative, is you do those other extra things that are kind of a little bit different that you wouldn't see normally in an advocacy program. One of the things that I know you guys do is like Spotify playlists for your advocates. Can you talk a little bit about that and how that is kind of seen as like, a thank you, an engagement tool, we're giving you something of value, open this email.
Yeah, so that was a good, I like that. That was a good
segue. You like
Nick is very good
on
at these
that.
things.
Yes. Honestly, it started, Marisol, former colleague, last year, actually came in and was, or called me up. She's in another office, and called me up and was like, hey, you like music, I like music. Let's get together and do something fun for National Health Center Week. So the first one that we did was for National Health Center Week. And then we had so much fun. And I say, selfishly, I love doing, I'm one of those people that if you made the mistake of asking me about music, I can go on forever and just be like, have you heard this person? Have you heard that person? So for me, it's like with these things and why we started doing it, I think partly, I think Susan was like, let them run with it, because that will keep them busy and out of trouble, which was great. But it was something to do where we would, and she loves the music too, but if we did one for like to help promote a national call-in day, so it was all songs dealing with phone calls, like Adele, and the one song that Lady Gaga has with Beyonce, and we just had a blast.
I saw Call Me Maybe on there. Call Me, I think it's Blondie's Call Me. Yeah, it's a solid playlist just outside of the phone call aspect.
So it was, so we try to, we've done one for National Health Center Week for both years, last year and this year. And this year was real fun, because this year we used the logo, or the theme for National Health Center Week was community health centers lighting the way to a healthier community. And it was, lighthouses. So I actually did it was all stuff dealing with water. And I grew up on Cape Cod, so unfortunately I have way too much memories of Jimmy Buffett and all that stuff. So
there's some country songs in there too.
I like it. Here we go. So I'm on, by the way, hcadvocacy.org. If you go to any of their action pages, Kristen and team do a fantastic job with this. We've got She Works Hard for the Money, Money, Taxman, Easy Money, Living for the City, Working Day and Night, I Want to Be Rich, It's Money That Matters, 9 to 5. This is amazing.
This must be a budget one.
It was, yes, it is about. It's about basically we're focusing on the finances of community health centers, and why we're asking for the the passage of these bills and stuff like that. So yeah, that we have that one. We have we did one for Black History Month. We did one for Valentine's Day.
Well, let's talk about that then for a second. So I like this because I think that in COVID times, just in general, but also associations have been trending to get a little less buttoned up, let's say, and a little more just, we're regular people here to help you, right?
Yeah.
And I think that the things that you guys are doing with these playlists, with these, 5-minute podcasts is only helping to press that forward because look, we're all on Zoom. We all have backgrounds. We all have whatever's going on behind us. We all have who we are. And that doesn't stop because we work in an association or somewhere else. And so this kind of playlist is just showing off that you guys are obviously work hard, play hard, but it's like, we want to get the job done, but we're here to provide you with, the information you need in a comforting environment with some fun added to it. And this is who we are kind of concept.
Yeah. I mean, for those who know me, who've known me for a while, know that I play hard at work. I can't, I have music going, well, not now, but I mean, I have music going at all times. I worked for a while. I worked at the International Monetary Fund, and my time there, it was very segmented of, you're this person, you don't talk to this person because they're, higher than you. I would walk into people's offices like it was nothing. And folks were just like, you're not supposed to do that. But, the division chief or the department head would be like, oh, Kristen, come in. What do you need? And so this is just who I am. This is when I go to work, or back in the good old days of actually going into the office, I came to like, okay, we're going to laugh. We're going to have fun. We're going to, we're doing some heavy lifting. And if you can't have fun while you're helping other people, why go to work? Or why, and it comes out. I mean, if you're stressed and you're unhappy with where you're working, it comes out when you're talking with, like on the smaller advocacy side with community volunteers, or when you're talking to staff at community health centers. Yes, there is a professionalism that needs to be, I tend to stretch it sometimes, but I mean, there is a professionalism that needs to be upheld. But at the same time, if you can have a good laugh during a situation, then that's makes it much easier for people to deal with all the hard stuff that's happening out there. And it could be out there in your office, out there in the professional world, or just out there in the world in general. I love that. Yeah, I'm very rose-colored glasses. I even like my hair.
I just think it's so important that people bring who they are, their like authentic self, to the office, because if you're not that person, right, it's just like after a while you start to get beat down, right? Yep. Like I don't love dressing up. I went to an all boys prep school when I was younger. We had to wear a shirt and tie, and after that I was like, I never want to do that again. And so like when I took my first job off the Hill, I was working at an association, and I was like, I don't wear whatever I want. Like, I don't interact with members of Congress on a day-to-day basis. I don't, like if I do, I'll wear a suit or whatever. But like, if it's just you guys, why do you care what I wear? You know what I mean? And I kind of got away with it because I was like the digital person, and they can wear like hoodies like Mark Zuckerberg or whatever. But it's like, okay. And I think COVID has helped in that sense that, we're all people. We have children, we have pets, we have other obligations in our lives. We are trying our best to get this work done. Like,
exactly.
You know what I mean?
I was I had hard pants on today. I was just like, oh, I have jeans. I can fit it.
Whoa.
Yeah, I haven't worn jeans in a while now.
I did that the other night though. I put on hard shoes for the first time in like months, and I was just, that was rough, right? Kristen,
this continues. I don't know. I hope that really does. I hope that continues. Like for associations out there, like if you're listening to it, I know we have a decent amount of our people, like push for those things that like make you truly happy in what you do, because you spend the majority of your week at work.
Yeah.
Like it's too long.
Yeah, I can't. I mean, I dial myself down. Trust me. I don't think anyone can deal with 100, Kristen at 100, and just in general. there's a small group that is like, that can say that they truly like, oh, I've seen her, oh, yikes, you know, but
watch out.
but at work, I show up to have fun. And the thing is too, is that stuff like the podcast, and you know, I've since yesterday we were talking about some stuff. I had some really cool ideas on additional types of podcasts for our group.
Yeah.
You know, like after the election, stuff like that. But you know, a podcast, or when I'm doing a webinar with folks from health centers, or I'm on the phone with people and stuff like that, it's like I just put my best foot forward. I mean, we're all human beings, and we all need to have a good laugh. I mean, we have what's called ACEs, that are special health centers that are advocacy centers of excellence. And so we have there's like different levels. And you know, since the COVID-19, we started doing Zoom calls like every other month, kind of check in, see how everyone's doing, answer any questions on what's coming up and all that stuff. And the first, I would say 5 or 10 minutes, it's just me trying to get people to laugh. Turn on your computer, you know, turn on your cameras, have a good time. How's everyone doing? And, you know, as I'm giving information, or my colleague Marie or Susan's giving information, you know, I try to, you know, say something or make people laugh about, you know, oh my God, people made me do my hair today, you know, and stuff like that. Just so folks, I mean, we're all in this together. And, you know, and if it's really good, especially for me, I live alone. So when I do get on a Zoom call with folks, it's to have some fun. And unfortunately, they're getting Kristen, who has not talked to anybody all day. So this is not a good thing. I mean, you know, when I always, like, we were kidding around. I was saying, at least at work, and why I like going into the office is that I have a controlled number of folks I can basically pester for 8 to 10 hours a day. And then I go home, and then I'm all spent. I go to the gym, and I go to sleep. We're good, you know.
Recharge the next day. Recharge. I like it. I
have the final question.
Nick, continue.
I'm gonna steal your final question, Brian. My question, all right, this is self-serving. You've worked with so many different organizations, and you've been in advocacy for a long time. I'm looking to hire someone at the Public Affairs Council. So if you're watching this, I don't know when it's going to come out, but you can go to pac.org and see our job posting. But there's a ton of other job postings. But there's obviously a lot of folks that are looking to get into the advocacy game. Mm-hmm. What kind of information, inspiration, advice you would give to the folks that are coming out, obviously, of college in probably the worst economic situation that there has ever been in the United States outside of the Great Depression, but are looking for a job that works for like a mission-based organization or just in the advocacy or public affairs kind of realm? What would you suggest to them?
It's funny because I pseudo had this conversation with my nephew who's living here in DC. I can't believe he's a college graduate. I was like, do you understand you're making me old? I'm not really like
my nephew and niece are not there yet, but okay, I know I'll feel old when that happens.
Yeah. But you know, I guess for anyone coming out, first of all, deep breath, and things will get better. I mean, I hate to say this. I mean, I guess I'm lucky with the fact that I fell into this. But you know, if you be creative in the positions that you're applying for, and you know, just because you may apply for a job that could be an admin assistant job does not mean that you won't grow into the position that you want. I mean, my first job with the Arthritis Foundation, bless Kevin Brennan or blame him, either or, depending on who you are, was literally temping as a front desk person for their GR, government relations department. That's all I did. But the thing is that Kevin noticed that how I was with people who were coming in delivering stuff, or how I talked to the chapter staff, how I talked to folks in Atlanta and headquarters, and then all of a sudden just started, pulling me into all these little projects I think kind of testing me to see if like, oh wow, if we ask her to do this and she does it, and folks are, are responding and sending us the information we need, this is good, And then all of a sudden, I was there for 7.5 years, which I know is an anomaly in DC sometimes, especially but the thing is, I grew in that position to the point where there was nowhere for me to go. So then that's when I kind of jumped ship and started looking for something. But it was literally a temp job. I think it was like 2 months or 3 months in is when they switched it over. Like they bought me from the the agency, and I became like a regular full-time staffer. Ooh, the bought me, that's not a good one. But oh well, but you know what I'm saying. But they, I would definitely tell people to, especially if there's a specific place that you want to be, is, just go in and just learn. Go in and find that person that is going to be your mentor, whether they like it or want to or not. Be that pain, and sit in those meetings and take it all in, and find that one or one person or two people that really like you and really want to help you advance. I think in every place I've been in, there's been at least one person who has kind of pulled me in and kind of helped me out. I mean, even when I was temping, that was kind of like, this is what it's like in DC. Because I moved down here, I was like fresh out of college. And just kind of like in my head, I thought I was going to get a job at Washington Post and was going to take the world over because I went to school for journalism. And here I am. I mean, I've kind of.
You're still producing content. You're writing content. You're doing all the things you do if you're a journalist.
Oh yeah, but I mean, I'm not, not knocking it down. And I'm like, oh my God, I got stuck in advocacy. But I mean, I think like in my head, I was going here. And then I realized that there was I was not going to go down that road. And then, I kind of, it was really the folks like a Kevin Brennan who kind of molded me and was like, hey, this is, ask the questions, read the books, what, there's a great, oh gosh, what is that book called? It was written by a gentleman, and it's on Amazon, and I actually sent it to my nephew as a graduation, while he was in college, because his graduation present was Lizzo tickets, but that's a whole other story.
Ooh.
Oh yeah.
Okay.
Auntie Kristen's the best. I will, if you call me auntie, I will, all my friends with little kids.
Okay.
But they
we'll include this book in the post notes.
Yeah. I listened to the book, but there's a book that's written by an LA or an LD on Capitol Hill back in the day when the this one particular piece of legislation, health legislation, passed. The thing with the public health that back like in the day when like he was working for senators who are now like buildings, their names are on these buildings. I mean, it was really, really interesting. And Kevin was like, read this. I read it and just took it all in, and how the process of him working on the Hill and him with people, but it's a great way to understand how it should work and how it works and how, and the positives of it.
We've lost Nick for a second to look for the book. He potentially has.
While we're talking about books, 2 books. I don't have the one book, but this book, Why Do So Many Incompetent Men Become Leaders and How to Fix It? Great book. Just calling ourselves out there, men, we make shitty leaders, usually. And there needs to be more women leaders. But this is a great HBR. You can also just read the HBR article and podcast by this guy.
Right.
Other one is Jamie Harrison is running for Senate in South Carolina against Lindsey Graham.
Love him.
He's raised more money than any Senate candidate in history in a quarter. He has a book on how to climb Capitol Hill because he was a Capitol Hill staffer and he was a lobbyist actually. So folks that are looking to kind of, it's written with a Republican who works at Ed Faro now, Amos Snead. And they co-wrote that book together. It's really great.
No, that
I think
was
it's
Jamie
also
Harrison that co-wrote that book. That's amazing.
Yeah, Jamie Harrison's the other person who wrote that book.
It's a
really
great book. I didn't even see that. Yeah.
Yeah, he could be a senator. We'll find out.
We'll find out. We are winding down here at the Advocacy Help Desk. This has been a fantastic episode here. I truly appreciate you joining us, Kristen. I think one of the themes that kind of runs through this entire thing, and I have it written down 3 or 4 times, is show your personality. Whether that's in your advocacy effort, whether that's in your first job, whether that's in whatever it is that you're trying to accomplish and being of value to your members, is, they've signed up for you, or they've chosen you, or you've gone to work there for a reason. And if you show your personality and those people stick around, then they'll be endeared to you. And if you show your personality and you're in a new job and it doesn't seem like it's working, then it isn't going to work, and you'll look elsewhere for something else and find that new mentor. So I like that as sort of a theme to this conversation, whether it's in your playlists, whether it's in your podcast, whether it's in your content, whether it's in your everything else, is if you show your personality, that's why people are members of your organization. Right. And so do that and you get somewhere. Kristen, your favorite musical show ever?
Ooh, concert?
Yeah. We got a couple of these. So real fast answers. What do you got?
I would say Foo Fighters, July 4th, a couple of years ago.
That's amazing. Favorite solo act that you've seen?
Oh, I hate you.
I get that a lot from you, so it's okay. I'm used to it. Go on.
I have to. It's Citizen Cope or Alice Smith, and half the time they tour together. So I'm sticking with that answer.
Ooh. I like it. Nick, any closing remarks from you, my friend?
No, I just think, Kristen, we're so lucky to have you on here. Your passion for advocacy. I've known you at other jobs, and this job, like always, is apparent to folks, and that just energizes me, and I think other folks that are in the industry as well. So I appreciate you being part of our community.
Oh, thank you. See, Brian, this is what being nice to people.
It's absolutely true. Look, you are one of the great personalities of our industry. It is always fun to see folks like you at events and just have you there. So we're really happy that you were able to join us today. Thank you, Nick, again for co-hosting. The websites you should be looking at are HC Healthcare, hcadvocacy.org. PAC.org, PAC.org, and PAC.org/jobs. The largest jobs board around for public affairs profession, and literally there are dozens, hundreds of jobs posted every day and every week, and it's coming and going, and there's a lot going on. So do look up those URLs. And then, of course, the Advocacy Help Desk, advocacyhelpdesk.com. We are on iTunes, we are on Spotify, we are on YouTube. Just look up Advocacy Help Desk and you'll find us. Thanks again to our wonderful guests and co-hosts for joining us. As I said, we're just here to help folks and give background. This was another great episode with literally another page full of notes that you'll find online sometime soon. So in the words of Andy Polk, who could not join us, thank you again and keep advocating.